Cerebral palsy is a condition caused by injury to the brain before birth, during delivery, or soon after delivery. The part of the brain injured is the part that controls muscle tone and function. There are varying degrees of CP. It can range from mild, marked by a mere limp, to severe, leaving a person wheelchair-bound and with other disabilities. In addition to impaired and/or involuntary movement, CP can also cause vision and hearing impairment, mental retardation, and other learning problems. There are three main types of CP, which include spastic, athetoid, and mixed. Spastic CP causes the affected to walk awkwardly due to overtoned muscles or muscles that are too tight. Athetoid CP involves involuntary movement for the affected due to undertoned muscles or muscles that are too loose. Mixed CP involves the affected having characteristics of the previously mentioned types. CP can affect only the legs and torso, or all four limbs, the torso, and facial muscles. CP conditions can become better for those faced with the condition with the use of early interventions. Therapy is also a common treatment for those with CP. Physical therapy, occupational therapy, and language pathology therapy are the most common types of therapy used for CP patients. As for teaching students with CP, I have had only one experience. The student was enrolled in my Intro to Floral Design class and actually had severe CP that involved all four of his limbs, his torso, his facial muscles. He was also vision impaired and had other learning disabilities. For this student, I allowed the use of recording devices in class since the student did have difficulty taking notes. I also paired him with an advanced floral student in class who helped him during lab activities. The student had difficulty assembling arrangements, but was a very good auditory learner. His partner would ask him how to assemble and where to place items in an arrangement, and he would tell her where to place them based on design principles that we had learned in class. He raised market lambs as an SAE. Another student was paired with him for this project as well. We modified showing by allowing him the use of a halter in the show ring, and his partner would stand by his side in the show ring in case the animal became too difficult for him to handle. Other SAE suggestions for any student with CP or modifications would be hippotherapy if there is a nearby facility. We have a nearby facility close to the school I work at, and many of our disabled students use the therapeutic riding as their SAE. I would also recommend rabbits as an SAE option for students with CP. The animals are placed in cages for the judge during both market and breed show classes, and the judge is the one who does the handling. I would suggest that showmanship be optional if the student's upper limbs are affected by their CP. If they choose to show in showmanship, they should be allowed a student assistant who performs the show steps with the rabbit at the command of the rabbit owner. If the upper limbs are unaffected, the student could still participate in showmanship and use a wheelchair or seated walker at the show table to perform the showmanship steps, and they would still be receiving lower body support. As for FFA, modifications can be made to require participation by allowing donations for FFA activity credit, such as coat drives, can drives, bringing snacks for meetings. But we should also make modifications to the meeting place so that they're at some type of venue where it's accessible for students who require the use of a walker and or a wheelchair. Lastly, I would choose games for entertainment at meetings that are also handicap accessible or that include all attendees or that can be played in the audience. This enables the CP student to participate in the meeting at all levels. These are just a few modifications I would use to enhance the AG experience for the CP student.